It's clear that electronic health records didn't go to med school. Otherwise, they'd have taken the Hippocratic Oath and operate by the universal medical maxim, first do no harm. Or so it would seem by the raft of articles detailing the harm being dealt to both physicians and their patients by EHRs. On the physician front, a 2016 study found that physicians spent about 2 hours doing computer work for every 1 hour spent face-to-face with a patient, regardless of the brand of medical software. Little wonder a 2018 Merritt-Hawkins survey found that 78% of doctors suffered symptoms of burnout. In fact, it's gotten so bad that there's a new Twitter account, @EpicEMRParity, channeled by a doc for docs, which has more than 14,400 followers in just over a month. Truly, if you're looking for a good laugh, you've got to read it. Even the august Dr. Atul Gawande offered plenty of reasons why doctors hate their computers in the New Yorker last November. But the unkindest cut of all appears in this 16-page April 2019 cover story of Fortune magazine entitled Botched Operation, Death by 1,000 Clicks. This investigative report was a collaboration of Fortune and Kaiser Health News, which is independent from the health plan, hospital, and med groups, which famously use Epic. At this juncture, EHRs have been around for quite a while. In fact, this year, Epic and Cerner are both celebrating their 40th birthdays, and Meditech is 50. Yet it was our tax dollars that put EHRs on the map. They were shovel-ready in the wake of the economic collapse, when President Obama signed into law the American Recovery and Reinvestment Act in February of 2009, stimulating the government's $36 billion investment in EHRs. The result, between 2008 and 2017, EHR usage increased from around 41% in physicians' offices to 86%, and from less than around 10% in non-federal acute care hospitals to 96%. Their adoption having been further stimulated by meaningful use incentives and penalties for lack of adoption. Of course, there are benefits to using EHRs. After Gawande spends the first 10 of his 25-page Why Doctors Hate Their Computers article sharing representative challenges the 60,000 partners healthcare physicians had with the rollout and aftermath of their Epic installation, he suggests a few silver linings in the electronic cloud. For example, quoting Greg Mayer, the Chief Clinical Officer at Partners, who said, "We think of this as a system for us, and it's not. It's for the patients." Turns out that Partners' patients, over 500,000 of them, love the ability to look up their lab results, remind themselves of medications they're supposed to take, and read their doctor's office notes to better understand what they've been told. In fact, one of the comments on @EpicEMRParity was from a patient basically saying just that. Dr. Gawande also described a solution that's now being tried out at Mass General, a virtual scribe service, in which India-based physicians document the encounter asynchronously based on digitally recorded patient visits. Compared with live scribing, the system called IKS Scribble is reportedly more accurate, since the scribes tend to be fully credentialed doctors, not aspiring med students, for the same price or less. IKS Health, which provides the service, states on their website that Scribble clinically, financially, and legally accurate documentation makes the job of the physician easier. With Scribble, physicians are able to return to the bedside interaction and clinical decision-making that inspired them to enter healthcare at the start. Meanwhile, the push for interoperability continues. One of the greatest expectations for EHRs, once they were operable, was to make them interoperable, with the ability to share records between providers and with patients. Frequently, that doesn't even happen within the same system. Famously, former Vice President Joe Biden was stunned and infuriated when he couldn't get his son's medical records from one hospital to another when Bo was battling stage 4 cancer. More recently, when her husband, Dr. Sanjay Mishra, collapsed in the airport, current CMS Administrator Seema Verma scrambled to piece together his medical background from various electronic records to send to the emergency room where he was taken. Nearly 2 years later, they still don't have access to all the key tests and monitoring data generated during his stay. Little wonder, last year she pledged a war on hospitals' information blocking and has promised to reduce the documentation burden on physicians and to end the gag clauses that protect the EHR industry. Never underestimate the power of the pen. In the near decade since Atul Gawande's New Yorker article, The Cost Conundrum, was first published in June of 2009, and has frequently been credited for propelling the creation and votes that passed the Affordable Care Act. This year, I'd place money that the combination of these two articles, Gawande's Why Doctors Hate Their Computers and Fortune's Death by 1,000 Clicks, will stimulate massive changes in the way electronic health records are currently used and abused within the next 5 years. Anyone want to take me up on it?